Well, I think there's a number. Obviously, one of the challenges is that the outcome or pace of the disease can be very different in different people. And I think the uncertainty of not knowing, is this disease going to be relatively quiet for a long time or become more and more challenging, is very disconcerting. It's very different than knowing this is how things are going to play out or not. And I think that emotionally is hard for patients, they're hard for doctors, and hard for their family to know, I don't know what next year is going to bring, I don't know what 2 years are going to bring. I think, moreover, suffering from bad symptoms can be very disconcerting. Not wanting to go to work, get out of bed, get off the couch. And so I think there are a lot of emotional issues that patients and their families have to go through. And we can deal with a lot of them, but they are real and very important.
So from my experience, the emotional challenges that a patient with myelofibrosis might face really deals a lot with the unknown. There is no curative treatment as of now for myelofibrosis, with the exception of an allogeneic stem cell transplant. And that option is limited to a few individuals who don't suffer from other comorbidities and who are eligible for the transplant itself, because that comes with its own set of complications. Because there is no curative intent other than the allogeneic transplant, dealing with the unknown and the uncertainty of if certain treatments are going to be available, if they're going to work in an effective manner, tends to be a source of emotional concern for patients as well as their families. In addition to that, some of the symptoms can be common and predictable, but some symptoms from the disease can be unique to the individual patient. We as healthcare providers know that the drugs we put you on and the treatments for the disease come with their own slew of side effects. And that's why we want you as the patient to be open and honest and really report those things to us so that we can help you manage those side effects in the best manner possible.
Particularly, I find that the frustration that comes from the fatigue is one that people are the most unprepared for. A lot of times we prepare for the physical symptoms, the nausea, maybe bruising, bleeding, but not necessarily how our activity level changes, our ability to tolerate the same behaviors that we may have before. And so along with that comes frustration, and a lot of times it's upsetting. With pain, we have medications we can manage it with, but there's no magic pill for the fatigue.
You should have access to all members of your healthcare team. This doesn't just include your medical team of nurses and physicians, but it includes case managers, social workers, and different resources along those lines. Do not hesitate to let these people do their job and to help you in the best way possible. Another thing that I would highly recommend is engaging in a support group, social networks, or support community. Myelofibrosis is a very rare diagnosis, and the incidence is only about 1.5 people per every 100,000 individuals, which really equates to only about 30,000 people in the United States. It is a really rare diagnosis, but there are people out there who not only have this disease, but are very knowledgeable about it. I would say engage in any way you can, whether it be through your hospital, whether it be through resources online, but a support community can do you well and can give you something that the people around you cannot.
I think using frequent rest periods, not waiting until you're completely exhausted to stop and rejuvenate your body. And really it's a practice in listening to yourself when you're starting to feel tired, not pushing through like you would if you just had a hard day at work. The other things that I think are important are using the resources that are out there, your healthcare team, your family, your friends, community organizations that can provide it. This isn't the time to turn that neighbor down when they make you a casserole or when a family member offers to run errands for you. I think it's important to utilize all of those people in an effort to conserve energy and really just make it easier to get through this time.
The critical thing is that knowledge is always your friend. And I think it's critical for patients and their family members to try to understand as much as they can about the disease, ask questions, read, talk to the doctor, get to know other patients with the disease, go to support groups, and really understand that nobody's in this alone. And there's a lot of other people going through the same issues, and sometimes they'll have solutions that you don't know about. So I encourage patients really to become part of a community of patients and doctors who work together.
Yes, it is very important to make yourself knowledgeable, to do your own research, to be very aware of what is going on in terms of your disease, your diagnosis, your treatment options, medical care, things along those lines. But it is important to remember that you are a very unique individual. You are going to present in a different way than any other person presenting with myelofibrosis. It's really important during this time to rely on your family members, rely on those people close to you, and really trust in your medical team. I would also say that no question should go unanswered during a visit with your healthcare team. They are there to help support you and to provide resources for you. So really just engage and be proactive and be your best advocate in terms of being able to live the best life that you can live and increase your quality of life.
I think be your best advocate. Ask questions and be involved in your care. Don't let myelofibrosis define who you are. You're still that independent, unique person that you were before the diagnosis. And as long as you continue to remind yourself of that, then you'll maintain that throughout the treatment and management.